cancerous tumor, but he only earns $1,200 per year. In times past, his family would have faced a stark choice: let Antonio die or be burdened with a huge debt. Sonia was determined to free the people of San Isidro from such cruel dilemmas. The Philippines runs a basic national health insurance scheme called PhilHealth to help with hospital bills. It's voluntary for people working in the informal sector. In the 90s, very few in San Isidro had enrolled. Sonia made the scheme compulsory.
We went down to the community and convinced them to help us in this health program. Because this is what you need. This is what we all need.
The town joined forces with PhilHealth to subsidize annual fees. The poorest were excused altogether. A clinic was built to provide free primary care. Residents now get free medicine and visits to the doctor. The scheme paid 3/4 of Antonio's hospital bill and entitles him to checkups to see if he's beaten the fatal disease.
Mahalaga kasi sa katulad kong magsasaka lang, malaking bagay na itutulong.
Programs like these are very important, especially to us farmers, because they help us a lot. I could have died if not for the program because I wouldn't have been able to pay for all expenses for my operation.
Kasi hindi ko naman kaya magpa-opera ng ganong kalaking halaga.
Freed from illness and crippling debt, Sonia insists the people of San Isidro are much better prepared for the current economic crisis.
They're happy because they're not sick. That's a major component in becoming productive. And when somebody is happy and they have dreams already, they're hopeful already, they can be very, very productive.
In part 2, who's helping the people who have suffered in the current global economic crisis? The millions who've lost their jobs. Cavite Economic Zone is a modern industrial estate on the edge of Manila. It was set up to attract foreign manufacturers and help lift local people out of poverty. Every day, thousands of young people queue for jobs. The factories prefer people in their early 20s. Today, Jenlyn Mercado is in the queue. She had a job here once, but was laid off 6 months ago.
Nalungkot dahil alam nilang din ako makakatulong sa kanila. Nag-apply din ako ng apply kaso wala din naman ako talaga na ano dito ang hirap. Dahil nga, tulad nga sabi ko, overage na.
She and her tricycle driver husband are expected to support their 2 children and Jenlyn's parents.
Baka sakaling makakapagtagpuna ako ngayon. Finish ba ako April this year lang. Hanggang ngayon wala pa ako nakikita trabaho. Pakahirap.
We're looking for production operators, female 18 to 25, single, at least high school graduate.
29-year-old Jenlyn is not hopeful. Schoolboy Eugene Avina fetches water from a pump in Rosario, a nearby district which relies on Cavite for work. His mum Juna lost her factory job last August as the global economy slid into crisis. The 37-year-old used to make luxury underwear for DKNY.
We were told DKNY pulled out, and that's why we lost our jobs. There's nothing we can do about it. For me, it's really painful.
She used to earn $30 a week, in addition to $12 earned by her husband, who's a fisherman. The couple provide for 3 children and Juna's mother-in-law, Socorro. In the good times, she paid to have the ground floor of her house rebuilt.
Kasi dati, yan pwede kong, ito kasi pinapagawa ko dati, bago, dati kasi ganyan yan, plywood.
Juna's house is a vivid example of economic progress interrupted by the global crash. She abandoned plans to rebuild the upper floor when she lost her job. And that's not all they're going without.
Mas maalwan kasi pag sinabi ng mga anak ko, ma, gusto ko makdo tayo, nakakapagkain kami sa labas, nakakaano. Ngayon hindi na kasi kulang na kulang talaga.
On just $12 a week between them, they join the millions going hungry. On good days, they live on a staple diet of rice and fish. But storms often prevent Juna's husband going to sea, and they have to improvise. They pour coffee over their rice to give it a bit of flavour. But sometimes they can't even afford that.
As parents, we feel really bad to see our kids go to bed without eating. But what can I do? I have no job. It's not like before. My daughter understands our situation and just keeps quiet about it. But it's my son who usually complains. He'd say, "Mom, I'm really, really hungry."
Jenilyn, Juna and Antonio would all benefit from basic welfare provision. But can a country like the Philippines afford it?